You are where you are in your life and career because you climbed on the shoulders of giants who went before you. This is a story of the Gene and Barbara Burnett Burn Center at the University of Kansas Medical Center and the University of Kansas Hospital, as remembered by Dr. Monty M. Monty. The unit opened its doors as a designated and fully contained center in July 1973. Prior to that, patients with burn injuries were treated on the general floors, the adults were on 3D, Delp Building, and the children were on 4L, Robinson Building. Burn patients were mixed in with other plastic surgery and general pediatric patients. The first plastic and reconstructive surgeon at KUMC was Dr. Walter S. Sutton. His claim to fame is that he did the early work on the chromosomal theory of heredity, the Sutton-Boveri hypothesis. Dr. Earl C. Paget was the second plastic surgeon at KUMC. Dr. Paget treated many burn patients in his day. Dr. Paget was born in Greenleaf, Kansas in 1893. He received his BS degree from KU and his MD at Washington University Medical School. He trained under Dr. Vilray Blair at Barnes Hospital. Dr. Paget was made professor in 1936. He is well known for his invention of the Paget drum dermatome. He collaborated with Dr. Hood, an engineering professor at KU in Lawrence. He displayed the drum dermatome, which was the first one that could cut a skin graft at a predetermined calibrated thickness. Dr. David W. Robinson was the next professor and head of the plastic surgery department. His curriculum vitae are impressive. His life spanned from 1914 to 2003. He is a graduate of Kansas University with an AB in 1935, MD from University of Philadelphia in 1938, and trained with Dr. Paget from 1945 to 1946. And he became a diplomat of the Board of Plastic Surgery in 1949. Dr. Robinson was the first one to dream about starting a dedicated burn unit with 10 beds for the treatment of burn patients. After obtaining the approval of the university and the hospital, he started a campaign to raise funds to build a fully contained and staffed center for burn patients. The concept was that the unit will be totally self-contained and that all medical and ancillary help would be brought to the patient in one location. A handwritten note from Mr. Gene Burnett about the involvement of the Burnett family in the early years of the dream. The contribution from the Burnett family was the final factor that made the fundraising such a success. With the support from Gene and Barbara Burnett, his dream became a reality in July 1973. Prior to 1973, the burn patients were managed by nurses and resident physicians under the supervision of Dr. Robinson and Dr. Masters. From the general surgical ward, the patients were moved in a trolley to a room designated as the Robo Room. The name came from a car wash that existed at the intersection of 47th Street and Rainbow Boulevard. Cars moved on a conveyor belt to get washed. Due to the similarity of the system, a former resident named it the Robo Room. Sterile technique was minimal. This shows dressings being applied at the bedside after Robo treatment. Pictured are Dr. Rodney Lowe, 1968 to 1970, and Mrs. K. Williamson. Depending on time, the fresh dressings were applied in the Robo Room or at the bedside. Hydrotherapy and immersing the patient in a tub of water became popular in the early 70s. The idea was borrowed from physical therapy. Some of the patients were seen and treated in this area, especially when they came in as outpatients. Agitators were used to help loosen the bandages and assist in debriding. Very soon it became apparent that cross-contamination from the tank and the appliances were major problems. The agitator was discarded. The tank and the plinth were covered in plastic sheets. This was the standard of practice for many years. Lewis Nicholson was one of the early burn wound technicians who raised the standard of care to a very high level. Dr. Robinson and Mrs. Joan Hirschberger. Joan was the second head nurse of the burn center. Since the Burnett Burn Center was the only one in the state of Kansas at that time, the unit was full most of the time. We also noticed many transfers from all over the state when the patient could have been easily treated in their hometown facility. Beds would be occupied by less critical patients, and there would be a scramble for beds when a critical patient arrived in the ER. At that stage, Dr. Robinson challenged us to create a triage and transfer protocol and educational program for the entire state of Kansas. This effort was started in 1975, and it took us 10 years to cover the whole state. More on that later. In 1983, we celebrated the 10th anniversary of the Burn Center. In that 10 years, the Burn Center had treated over 1,000 patients. The Burn Center celebrated its 10th anniversary, celebrating its achievements. Mr. and Mrs. Jean Burnett were active participants, as well as several of the burn survivors. Jan Fisher is seen here with Mr. Jean Burnett. In its 20th year, in 1993, a major effort was organized by Rosie Thompson and her team. The goal was to move the location of the Burn Center on 6B to the newer part of the hospital on the 5th floor, its current location. The fundraising effort was called the New Frontier Auction, and much preparation went into this. Gary Kale, a former patient and an artist using stainless steel, and David Kuntz, the very first admission to the Burn Center, are seen here. David Hurlbut, burn survivor, was a major factor in making this dream a reality. The Burnett Burn Center moved to its new state-of-the-art facility in 1998. The Burn Center, which operated from 1973 on the 6th floor, spent its first 25 years there. The new facility is still the Burn Center, with the added Hurlbut Pavilion. Dr. Robinson retired in 1985 after a long and illustrious career. He was described as a professor's professor. He trained over 50 residents. Many of them went on to teach and train others. He was described by many as the gentle giant. Plastic surgery and the Burn Center owe a huge debt for the vision of this man and his perseverance. We, his trainees, remember some of his memorable sayings. One was, "You bring her, you dance with her." Dr. Frank W. Masters, the second senior member of the plastic surgery faculty until he became the head of the section and then the head of the Department of Surgery. Peg Valverde started in 1973 as one of the unit secretaries. She wanted to do more and so took time off to go to nursing school and returned as an RN. Peg rose to the position of assistant head nurse and worked many years as an enthusiastic member of the team. Patient care was always the primary focus of the Burn Center. Dedication and team effort were emphasized by Dr. Robinson. Faculty, staff, and residents worked together. Every member from the housekeeper, dietary aide, therapists, pharmacists, consultants, nurses, and doctors were treated with respect. A quote from Dr. Monty: "I may be the quarterback of the team, but if the members of the defense and offense do not put out 100%, we are not going to win the game." Joan Hersberger, head nurse at the patient's bedside. Joan was the second head nurse of the Burn Center and was involved with all aspects of care, teaching, and outreach. Olivia Williams, physical therapist with a patient. Physical and occupational therapists were assigned to the Burn Center from its very inception. Ruth Dobbs was head nurse for several years, then she moved to North Carolina. Janelle Epp, occupational therapist with a patient. She is one who came back to the Burn Center after a few years of working elsewhere. Janelle is a link to the past. Maria Pena, the current nurse manager. Maria is also a link to the past. She remembers some of the events from her early days as a burn nurse. Angie Morrison. Angie came to us from Germany. She brought some of her German expertise for precision and efficiency. Some of the early pioneers in the field, Beth Hope and Becky Griffith, elevated the rehabilitation of the burn patient to new levels. Compression therapy for burn scars was a new innovation. Becky did some of the early studies using compressor grip. Dr. Mani, Cassie Farah, and Teresa Trafton with an outpatient. Family support meetings started very early in our history. Linda Appleton with some family members. The need for this was felt early in our history. The Burn Center initiated a group of burn survivors to form a support group, and the name of this group was Burn Recovered Organization. This later went on to become Mid-Continent Burn Foundation, which now is the Midwest Burn Foundation. Teaching medical, nursing students, and allied health students all started very early in our history. Rosie Thompson took a lead in our early years. The Burn Center faculty and staff taught students from the 3 schools, residents, community colleges, and local schools, and taught safety for industry like KCP&L, Gas Service, Rockwell, and others. Outreach education started very early. Burn care was taught to medical people in all the major towns in Kansas. The Burn Center initiated the first program for the statewide triage, first aid, early resuscitation in the field, and transfer guidelines. The lessons that we learned during this effort were later taken to Malaysia, Kyrgyzstan, India, Alaska, and Australia. As part of our outreach, we initiated an ABLS program for the state of Kansas. ABLS stands for Advanced Burn Life Support. This program was taught in several towns in Kansas. This is David Hurlbut, a familiar figure in the Burn Center even today. One of the most courageous persons who survived a terrible injury with his spirit intact. His accident and recovery gave the impetus for the next phase of development and evolution of burn care at KU Hospital. During our 3rd decade of progress came new ideas of privacy, reducing of infections, and more physical and psychological rehabilitation. Today we strive to give the best care to the burn patients and to live up to the legacy these men created. We have done our part. When we started, we had no dedicated center or a designated team. We had to innovate and be creative in a general ward setup. Over the last 38 years, the idea of burn care has evolved to what you practice today. You climbed on the shoulders of the giants who went before you. Will you lend your shoulder for the next generation to climb even higher?